Hey everybody, good evening. This is Dr. Sullivan with you for another Eye Care for Your Brain lecture. Tonight we are talking about a topic that is so near and dear to my heart. I'm hoping that it matters to you as well, and maybe that's why you've tuned in. I've been with you since October every week trying to give you my very best information, my best evidence-based recommendations to help empower you about brain health. And really the reason I'm doing this is related to our topic tonight. It's about patient-centered brain health care. What is it? What are the barriers? What are we going to do about it? And then at the end, I'm going to tell you about my summer school program and how you can be with me weekly for a series of 9 lectures that I've worked really hard on over these last few years, and they're finally ready to share with you all. So thank you all so much for being here. One thing that is very important that we keep in mind with brain health care is that you're going to hear in the news about advances in neuroscience that are very impressive. So these are things like stem cell therapy, gene therapy, things that take very smart people a lot of money and a lot of time to work on. And I think we would all agree that that is welcomed, that is needed. We are all anticipating big breakthroughs in things like stroke recovery and Parkinson's disease and essential tremor and dementia and depression and all of the stuff that happens with our brain. But we can never forget that while we're waiting for the next big breakthrough, that human beings are in need of care today, and we have a job. We have to encourage and support and advocate for progressive brain health care starting now. And this is what we are here talking about. So personally, the way that I have chosen to serve other people in my career and in my life is that I am much more concerned with people, human beings, than I am microscopes and petri dishes. I'm going to leave that to people who are smart in a different way than me. But what this means is that I am very focused on care. I am very focused on how is it that I can provide the best care, and the lens that I use for making my decisions is this patient-centered care model. So I want to talk to you tonight about what exactly that is. And we have barriers that prevent it from happening consistently enough. And we also have things that I'm trying to do I want to talk about, and things I think you could be doing to help move this along, because it is going to take a movement. It's not going to be one person trying to put this big giant boulder up the hill. So essentially what patient-centered care is trying to break the old school hierarchy between the all-knowing doctor and the passive recipient of information, which is the patient, maybe you. That model is that the doctor has all of the expertise and that you are just simply there to hear from the Almighty about bits and scraps of pieces of information about what's going on with you and what they say and all their infinite wisdom you should be doing about it. Well, the 2 parts of the patient-centered care model speak against this. The very first part is that patients and doctors need to be partners. They need to be collaborators working together for the benefit of the patient. So what does this require? This requires eliciting and respecting the expertise of the person in the room who is actually living with the medical condition that the doctor, the nurse, the psychologist is trying to treat. Okay? The second one is that medical providers expand their view of what care means from simply the medical or the physical, and we incorporate things like the person's mental health, their social health, their spiritual health. And if you know me, you know that one of my big things is brain health care is not just about the brain. You have to acknowledge that the brain is one aspect of the person's functioning, that what we should really be caring about are the people who are living with the brain challenge, okay? This leads to active collaboration, shared decision making, and both sides are invested in creating a personalized treatment plan for the person. And when people are invested, that's when they're going to be motivated to follow through on recommendations, and they're going to get the very best recovery and care that they possibly can get. So what genius came up with this idea? Because in a way, it's so common sense, it's so ethically correct, it's the right thing to do, but the truth is, Hospital systems, medical schools, psychology programs, they really haven't focused on this until about the late 80s. And it really started in an institute in 1993 called the Picker Institute. And they put forth 8 recommendations for what this type of healthcare would look like. And I want to emphasize 4 to you tonight. So the first one is respect for patients' preferences and values. So you have to know what those preferences and values are in order to be able to respect them, right? The second one is being concerned about their emotional comfort. How are they experiencing their medical symptoms? How are they experiencing the feedback that they have a brain tumor, that they have a stroke, that they have been diagnosed with Parkinson's disease? And the next 2 are so important to me. Information, communication, and education. How is it that we can take all of this knowledge that we have from higher institutes of learning and all of our clinical training and translate it, communicate it in a way to patients that A, makes sense, so we're not talking up here, but what I find happens maybe more often and personally annoys me to no end is talking down, not sharing enough information, withholding. I always try to put myself in the position of the person sitting in front of me looking for care. And I know that I would be an information hound. I would want to know what exactly has happened to me. Why has it happened to me? What am I going to expect? How can I adjust and adapt? And the truth is, in a non-patient-centered care model, that focus, that commitment is just not there. And there's really a huge reason that's happening, and I'm going to tell you about that in 1 second. Now, this is not ubiquitous across the world, okay? Canada, for example, if we have any Canadians listening, has adopted patient care for decades now, and it's inherent in all aspects of the care system. So hospitals, healthcare centers, in their mission statements, there's always a reference to respecting persons. And, you know, I'm coming to you from the United States in North Carolina, and we certainly need to do a better job from where I sit in getting to more of a patient-centered care model. So the truth is that care has to occur within the context of empathy and connection. And that's one of the big ways that I think brain health doctors, now, you know, I'm not talking about everyone. I have so many colleagues that I work with. I have amazing people in the town where I work that are truly serving from their heart and share information all the time and follow patients and call them and really, really care. But I also hear horror stories of people who have been diagnosed with Parkinson's, as an example, and not told at all that they can also expect retrieval problems or anxiety problems, just as they do tremor. Or people who have had a stroke and have never been explained where in the brain they had the stroke or how that is going to affect not just the way that they use their arm. So I'm hearing this all the time, every day, and it's completely informed the type of doctor that I try to be. And really, care and communication connection has to happen through a few different things. One is eye-to-eye contact. Okay, empathy, two-way communication. It can't be a lecture when you go to see your doctor. It's really meant to be a reciprocal exchange of ideas and information, and what have you noticed, and this is how I feel, and it's a back and forth. If you ever feel like you're being talked to more than you are being talked with, that is a problem. So a few minutes ago, I said, you know, there's really one thing that is the barrier here that's getting in the way. And I think that it is time that doctors, nurses, psychologists don't have to form these bonds and these connections. So this is happening because the way that providers are evaluated professionally is changing, and right now the mode of evaluation is based on productivity. There are these little dastardly things called RVUs, relative value units, and this is how your doctor is being evaluated by the administrators at the hospital. This is basically a volume metric. How many patients are you seeing? How complex are your patients? So this has kind of replaced some patient satisfaction surveys. Now that stuff still happens, of course, but the main way that people are evaluated in their performance reviews, the way that people are given salary advances, is simply a numbers game. the flip side of these RVUs is it's not just how many patients you're seeing, but to get credit for the RVU, there is a mountain of paperwork that you have to do when you are a doctor working in a medical system. This is why your doctors are now talking to you like this. And they're on their computer, and you probably know the side of their face or the back of their head very well, because we are losing the very basis of connection and empathy, which is simply looking people in the eye. This was one of those things that drove me out of academic medicine, is that I simply could not continue to focus more on a computer screen than I was people in front of me. So the truth is, your doctor may have a huge heart and maybe got into this field for all the right reasons, but the truth is that there are oppressive administrative forces overtaking their ability to connect with you. So some of this change has to be systematic. It has to come from the top down, but I think that we can do some peaceful revolting and some assertive communication to encourage this all to happen. So the norm now for a follow-up appointment, and you all know this, is about 7 to 8 minutes. So if you go to a primary care doctor, in 7 to 8 minutes, if you only see them once every 3 to 6 months, you're not going to get to some of the things that I care about most in that time. So that is brain health, right? Memory, mood, irritability, recall, word finding problems, because it's under the surface and it's just not as obvious. So how does this relate to brain care, right? So like I said before, people who aren't told in-depth information about their diagnosis, people who are invalidated when they bring up concerns about their brain. We see this often in older adults. You know, what do you expect? You're 75. We also see people not getting full, thorough neuropsychological evaluations. You know, this cognitive screen, remember these 3 words, what year is it? Okay, that took 3 minutes. Okay, you know, I figured this out and here's the medicine, or I think you're good. One of the things I'm going to encourage you to do is advocate for a full gold standard evaluation, which is a neuropsychological evaluation. The other thing is we really aren't respecting what we call somatic symptoms. So what does this mean? This means symptoms that are perhaps emotional in nature, perhaps are based in emotional pain and trauma, but people who may not have advanced coping skills express them through their body. So these are unfound medical issues, headaches that won't go away, stomach aches that won't go away. And when a doctor can't figure it out medically, the truth is I think people are written off because it's all in your head, not respecting that that symptom is just as valid as something that you can measure with a blood test, right? If we could measure depression and anxiety with a blood test, we would, and it would be a lot easier to communicate with our doctors about what's happening. So these are some statistics that really bother me as it relates to dementia, which you guys know is very important to me. So 50 to 65% of people who've been diagnosed with dementia have no documentation of this diagnosis in their medical record. I ask you, what other medical diagnosis would this be acceptable for? If someone had breast cancer and you got your medical records and it had no mention of the fact that you had breast cancer, you would be pretty mad, right? Because that's care coordination. That's how your other doctors know what's happening with you. That's very important for a lot of different things. Caregivers report that it typically takes over 2 years to get a diagnosis of dementia after the first time that they bring it up to a medical provider. Folks with mild cognitive impairment or communication issues, language issues, often tell me and tell researchers, I am ignored. Doctors don't look me in the eye. If my spouse is with me, they're going to get all the attention. People are talked to like they are stupid, like there is something wrong with them when they are perceived as having a mild cognitive impairment, and people get ignored and they don't get validated, and this is not okay. So what are some barriers on the medical side? I already told you that time really is a huge barrier. Well, there's a couple other ones too. The first one that comes to my mind is this tendency to downplay or minimize people's concerns about cognition. Oh, I do that too. Oh, let me tell you about this funny thing I did when I left the sugar bowl in the microwave the other day. It's not really taking serious how concerned you might be. So that's one. When it comes to cognitive impairment and dementia, there is also this doubt that I think holds doctors back about the perceived limited treatment options. So in a way, like, why tell them because there's nothing we can do about it, which is absolutely false. The next one, when you look at the research, is fear of depressing the person. Now, I find this to be very disrespectful. Let the patient decide if they are bothered by the news. Don't you, as a doctor, hold back saying something that is truthful because you think that the person cannot handle it. That is very arrogant. There is a lack of knowledge for what to do next. Who do I send this patient to? I don't know who in my community is a brain health doctor. So it's just about access to care as well. And the final thing is, we have to face it. There is still a huge stigma about mental health and about cognitive health. People choose different professions for different reasons. One of them is their personality and the level of emotional display that they are comfortable with. You're not, it's like the old stereotype about surgeons. A surgeon is not going to be there to give you a hug, most likely, before a brain surgery, and maybe that's okay because we want them to be very laser focused and very technical. Now, of course, there are some surgeons who are huge sweethearts, but I think you get my point. People go into different fields. So people who are in, social work, psychology, speech and language pathologists, these are people who are going to be more comfortable with emotions. Some personalities may have picked certain types of medicine because they want things to be cookie cutter. They don't like the ambiguity. They don't want tears. It makes them feel uncomfortable. So they're not going to pursue this line of questioning. So there really are 5 things that I think have to change if we are going to arrive at a state of more progressive brain health care. So the first one is we have got to revive the lost art of listening. It's really not that complicated. Just don't have doctors looking at computers. Train them on how to make eye contact with patients, how to talk less and listen more, and to genuinely be concerned with the patient's everyday life, not just the 15 minutes that you might be seeing them in the office. The next one is caring. Reserving judgment, being sensitive to psychological adjustment, making sure that you're not just focused on the medical. If we reduce care to lab values and how many steps people can walk, that is so inhumane to me. Like, we are sensitive, emotional, spiritual beings, and we have to be attended to. We are not just physical issues. We are not just physical or cognitive disabilities. We are people, and that has got to be respected. The third thing is high quality patient information and education. Every person who has a brain health concern, they have been through a scare, they've been through an event, they have a diagnosis, either for themselves or someone they love, has the right to be educated upward and down, backward and forward about what is this? What does it mean? What is the current state of the research? What do brain scientists understand? This is happening to you, and your doctors need to take all of their good fortune and all of their blessings of how they got trained and got into medical school, got their PhD, and give it back to you as the patient. I think that is a responsibility that doctors have. Number 4 is valuing the expertise of the person in the room who's living with the brain health challenge. And I said this before. That doctor most likely has not had a stroke. You have had the stroke, and the doctor needs to be looking to you to learn something. It's not just about the doctor here and you here. You have to find collaborative providers. Yes, they have a type of expertise that you don't have, but you better own the fact that you have a form of expertise that they do not have. You never, ever, ever can forget that. Psychological evaluation. So every person who is concerned about brain functioning really should be offered a referral to a neuropsychologist, because, as you know, the more we get to work together and you understand what I do, this is the gold standard. We are great listeners. We are comprehensive. We have the best tools for understanding brain function in the context of a human being. And so we love to figure out what the heck is going on here, what are all the layers, and what are we going to do about it? Those are our 2 favorite questions. Neuropsychology equals personalized brain health. That is an absolute fact. So let's talk about what you can do. What are the things that you can do in your world with your power that will help to reverse this tide a little bit? So the first one is prioritize conversations with your medical providers about your brain health. Make a list, write down concerns. So by brain health, I don't just mean memory. I mean all aspects of cognition. So your attention, concentration, word finding, learning, memory, but also mental health. That is a part of brain health. Your mood, depression, anxiety, irritability, wanting to socially isolate. You are probably going to have to be the one to bring these things up. You're going to express your concerns. You're going to express your fears. I want you to talk about how it's impacting your everyday life, your quality of life. And then I want you to take a step back and listen and watch and see how they respond. If they respond with empathy and eye contact and information and a plan, I want you to tell someone who monitors their performance that they did a good job. We have to reward and reinforce when things are going good. If you find that they are invalidating you, they don't look you in the eye, they don't take you seriously, then I want you to get a patient complaint form and write it down and send it to the hospital, send it to the doctor's supervisor, the owner of the practice. So somebody understands that I had an experience that did not make me feel like my care was the most important thing in the room. I felt like a number. I felt like I wasn't heard. I don't feel like my care is personalized. I feel like I was invalidated. So either way, you're going to give feedback, okay? So whether it's positive or negative. You should feel very comfortable to ask for a referral to a neuropsychologist. You might have to be the one to educate them about the benefits of an evaluation. And the most important thing that you can do is to become an informed advocate. The more you know, the more you're going to know in a doctor's office if you are being talked to at that down level, right? And when that happens, you're going to use your assertive communication skills to respectfully say, thank you for that information. I actually understand that part, but here's a question that I have about my recovery. Here's a question that I have about my brain health. Here's a question I have about my cerebellum, right? So you have to be the one who's going to kind of push it, and you can do that for yourself, or a loved one can do that for you. So this begs the question, of course, well, hey, Dr. Sullivan, what are you doing about this? Well, I am the owner of a private practice where I try to infuse everything about the experience my patients have with a patient-centered focus, from the way we talk with them on the phone, to the forms they fill out, to the way my staff is trained, to the doctors that I pick to work here with me. And I think we do a really good job. I have to tell you, I'm very proud of the way my practice runs. The other thing is that I try to do longer outreach in the world, like these lectures. And for the last 2 years, I've been going around to communities in North Carolina talking about these 8 pillars of brain health. And I so desperately want to educate people and then help them take that new learning and put it into practice for behavior changes that are actually going to result in better brain health. If you've been watching for a while now, you know this brain fitness industry drives me crazy. These supplements, the brain games, it's honestly, the vast majority is a waste of money, and it's extremely expensive, and there's a lot of marketing tactics that are based in fear and anxiety, and it's just not an objective scientific approach to brain health. So in that spirit, I want to tell you about summer school. So I have had postings over the last year or so about when I do a talk in North Carolina, and a lot of folks email me and say, hey, are you ever going to do this online, or how can I be a part of this? And now finally, after a lot of hard work behind the scenes, I'm finally ready to bring it to you. So starting on June 13th, every Wednesday, there is going to be the release of a video lecture there's 9 of them all together, and they are based on these 8 pillars of brain health that I've identified. And the 9th one is kind of a recap and recommendations. But there's 2 parts to my lectures. There is always the psychoeducation part, hey, let's get you really, really, really educated about this topic. And then I transition into evidence-based recommendations. What are you going to do about it? So they're each about an hour long, but what I love so much is that in addition to watching the lecture, every single lecture comes with a 68-page color companion workbook. And in these workbooks, we got 9 here, and I know they're backwards, but I do want to share them with you because I'm so proud of them. They have all the lecture slides, articles about the topic that I've written, but there's a lot of interactive activities, and this is where you make the learning personal and you figure out, okay, I know what she's saying, but how is it that I can apply it to my own life? To me, that is the greatest thing that I'm offering you, is the application of the knowledge. So what we're gonna do every Wednesday night at 6 o'clock throughout summer school, so this is June 13th to August 8th, is at 6 o'clock I'm gonna do a live question and answer based on the lecture. So if you've watched it, you can tune in and you can ask me any follow-up questions, and I'm gonna do like a little bit of a recap and talk about how to implement the topics. So what you can do is go to www.icfyb.com/summer school, and that's gonna actually give you a 20-minute preview on how it looks, how it works. Last summer I actually went into a studio and recorded these lectures, and throughout this whole year I've been working with my collaborator on these workbooks, and let me tell you, it has been a lot of work, and it is something that I'm incredibly proud of. One thing that's very important to me is making sure that good quality brain health information is accessible and affordable to folks. Now, I did just want to touch on this for a second, because everything that I've been doing since October has been completely free, right? Once a week we meet here and I talk for about a half hour or so. This isn't free, okay? There was a lot of overhead that had to go into this. The filming, the editing, the graphic design, the printing, a lot of money was spent. So I've worked very hard to get some sponsors over the last year to keep the costs as low as I can possibly get them. So you have a choice. You can watch me for one of the lectures, and that's $27, and that includes the lecture, the workbook sent to your house, the hard copy, or if you bundle them all together, all 9, it's $197, which is about 20% off. So again, that's all shipping and handling, all taxes, hard copies of these 68-page color workbooks delivered directly to your house. So I am incredibly excited. I hope that you guys will go to the webpage and just see what it is that we're offering. See if it feels like it's a good match for you. The lectures have been an absolute labor of love. So thank you guys so much for joining me tonight. I'm incredibly blessed and feel so lucky to be in this position where I get to use all of the experience and expertise that has been bestowed onto me to help people and to hopefully alleviate some suffering. So remember, you've got some work to do. I'm going to keep doing what I can do, and we will meet back here next Wednesday. Thank you guys so much, and go to that website. Bye-bye.